Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD. I'm glad to see many new faces here tonight, but also a lot of familiar names showing up on my list as well, too. So for those of you that are new to the webinars, the way that the webinars work, you get to create them with your questions. And each week, these webinars look a little bit different, although sometimes we cover back over some of the same questions that I have in the weeks before. Tonight, for those of you that may not be aware of it, you may see my friend Thor back there. That's Thor back there, hopping around a little bit, and you may see his sister Halo too. So if you see some black flashes, those are my dogs. I bring them into work here with me during the day, but also especially here on these nights because I get out of here a little bit later for the webinars. So you may see those, my friends hopping around back there too. The way that these webinars work, you write the questions to me, and where you can do that is there is a screen on the right-hand side of the screen. There is a box, that's a chat box. Write your questions there. I ask that you do not hit the enter button more than one time per question. If you hit the enter button before you complete your question, what happens is that poses multiple questions on my screen. The way that what I will do during the webinars, I will be posting your questions on the screen so that those of you that are participating in the live webinar tonight will actually be able to see the questions posted on the screen. If you are looking at this in the recorded version tomorrow, you will not be able to see those questions posted on the screen because they don't actually show up during the recorded version. And while I'm speaking about that, I'm recording this as a podcast tonight too. And there is now a place on our information site where you can actually pull up both recorded video versions of this as well as podcasts. And the thing about the podcast, if you want to, you could even download it onto your phone, for instance, and listen later as you're driving around or doing grocery shopping or other activities as well too. I hope in the next week or two to actually have an iTunes station created for this so that you can pull up the podcast of this on iTunes. And I'm going to be looking at putting together some of the previous recordings as well. Want to make sure that you can get as much of this information out there and is easy for you to get it and listen wherever you are. So feel free to do that. But also when I get that up, and if you want to share this with your friends, let them know. I want people to get this information that we're discussing here tonight. So the podcast station, when I get that set up through iTunes, will be open for everyone actually too. So with no further ado, let's go. Oh, one last thing. Tomorrow morning, you will get an email from me, and in that email, it will include a link to the webinar recording. Look for that in the morning. In that webinar, also, you will be able to sign up for next week's webinar. Next week will be the last webinar for January. I will not have another one of these until February. Okay, so we got tonight, and then we've got next week. So with no further ado, let's go ahead and get started. I look forward to the next hour and a half or so with you, okay? All right, let's see here. So I'll go ahead and post up the first question. So this is from Kathy. Hello, Kathy. Let's see. I herx on, hold on here. I've got it. Something's not working right on my end here, guys. Just a second here. Okay. So let's see. I herx on very small doses and don't detox well. Should I take care when taking all herbs, vitamins, and supplements? Could they build up in my body and be harmful? I'm trying cholestyramine with curcumin. It looks like I'm only going to be able to tolerate 1 scoop per day. All right. So I think, Kathy, what you're asking is, given that you have a hard time with detox, is it going to be difficult to even deal with the herbal medications as well? And the answer is, I think it's going to be very dependent on which herb. And that I would go ahead and try different herbs out and see if they start having problems with you at all or not. In terms of the curcumin that you are taking, curcumin generally, I don't find people that have toxin issues develop problems specifically with curcumin. So I don't think you're going to have a problem taking curcumin. For those of you that may not be aware that are new to the webinars, curcumin is an herb that I like to use to lower inflammation chemicals that get overproduced in Lyme called cytokines. In fact, if we look at this, what Lyme disease symptoms are actually excess cytokine symptoms. Cytokines are good and bad. Cytokines are made by white blood cells when they see any kind of an infection. They're designed to turn the immune system on But in Lyme disease, because the immune system does not do a good job of dealing with this infection often, you can get too many cytokines made. The immune system tries harder and harder and eventually makes too many cytokines. Too many cytokines give us mostly of what we call Lyme disease symptoms. So curcumin is a way to go ahead and regulate the immune system's production of cytokines. It makes it so white blood cells do not produce as many cytokines. And therefore, people have less Herxheimer reactions, and also they have less Lyme symptoms. Now, the issue with your cholestyramine, Kathy, is when you start pulling toxins out with cholestyramine, that also results in more cytokines being made, believe it or not. So when we're moving toxins out, which is a good thing because toxins also trigger cytokines, the act of detoxing, unfortunately, if we do it too aggressively, in some people can trigger a cytokine flare, which looks like a Herxheimer reaction, for instance, okay? So what I would do is with the cholestyramine that you are using to bind up toxins in your intestines, to pull them out of you, is I would go slow and try it 1 scoop a day. If you tolerate that, after about 7 days, then you might want to go ahead and increase it then to 2 scoops, 1 scoop twice a day, but do it based upon what you can tolerate. In terms of your general question, it's hard for me to say which toxin or which herbs do you need to be more careful with if you're having detox problems. In general, I don't think you have to be that careful with the herbs. You may need to be more careful with the antimicrobial herbs, like the Banderol Cemento that I recommend to kill Lyme germs, okay? But if you want help more specifically, Kathy, the one thing you may want to do is to actually have a visit with me. And there's one way that you can do that, which is to participate in one of my online webinars, one of my online visits. And so I'm sitting here, everyone, at our main information site. I'm screen sharing with you right now. This is www.treatlyme.net. And I am actually looking at an article within the Treat Lyme book, but I'm going to go to the homepage. This is the homepage of treatlyme.net. If you look over on the left-hand navigation menu, you're going to see a spot here. I'm kind of moving my mouse over. It's called Online Consult. And go ahead and click on that. Through these online consults, anyone can do this online consult. I can give you advice about your health care. Because I am not able to physically examine you, though, I cannot prescribe medications, nor can I order medications. But if you want more detail about how this works, just read through this page. You can see here I give you information about requirements and a disclaimer about it. But generally during these visits, I can help figure out what to do for you. Many of my recommendations do not require somebody to prescribe anything. And if they do, though, I write up a medical visit note. I send it to you. And then you can use the medical visit note to show your doctor and see if they might prescribe some of the recommendations for you too. But if you do want a little bit more information about specific herbs, I'd be glad to do that. And this is one way to do it, is through my one-to-one medical consult service, all right? And while I'm sitting here at www.treatlyme.net, as I told everyone earlier, I now have I'm producing these webinars in 3 different ways. And so you're seeing a little bit of a change over here. On the left-hand navigation menu, there's now a tab called Lyme Q&A Webinar. And one of the options is video recordings, and the other one is podcast recording. And as of tomorrow, it will be changed to podcast recordings with an S, all right? So there's different ways of getting playbacks here. And again, I encourage everyone, please share what I'm doing here. So that more people can participate, whether they participate in the live webinar or whether they participate by listening to a podcast when they're grocery shopping or whether they participate by rewatching the webinars. The more information we get out, the better the ability it is that I have to help as many people as possible. And that's what I'm trying to do here, is to help as many people deal with the consequences of this horrible illness that many of you face. So thank you, Kathy. I know that's a little bit long-winded. I showed you some things, and I only partly answered your question, but for more specifics, I would recommend that one-to-one medical consult. All right. Thank you. Good luck to you, Kathy. Let's see here. Pull up a next question, and to do that, I got to get rid of the one from Kathy on my screen, and then this is one from Pat. Hello, Pat. Let's see. Hi, doctor. Given that Lyme causes physical damage, what do you recommend in the way of physical therapy and exercise? Thanks for the webinars, by the way, they're great. So in terms of exercise, and I need to develop a better information page in the Treat Lyme book about this, or an article in the Treat Lyme book about this, and it's on my to-do list, with my forever growing to-do list in terms of ways that I want to improve the Treat Lyme book. But in general, at this time, my recommendations that I give anyone about exercise in Lyme is to do exercise to tolerance, okay? And what I mean by tolerance is you need to find a level of exercise that you can do that you don't pay the price the next day. And what I mean by paying the price the next day is if you are exercising and the next day you're more fatigued or more sore, that's too much. And that degree of exercise, if you do it repeatedly, may actually suppress the immune system. So that's what the issue is, okay? And I don't even care what type of exercise people do. You can walk. For some people, it may be just stretching. Find something you enjoy doing and do it. I know that one of my colleagues says that you shouldn't do aerobic exercises, Dr. Burrascano. I disagree with him. I think aerobic exercise is fine. You just got to be careful to do an amount that you don't pay the price the next day. And so what I would say is you need to look by trial and error to find out the degree of exercise that you can tolerate, all right? So those are just some general ideas that I have about exercise, Pat. All right. Thanks for that question. Good luck. All right, let's see here. Okay, so the next question is from Hem. Hello, Hem. Let's see. And I think your question, unfortunately, got posted in two parts. And that's because you hit enter twice. Do not hit enter more than one time during a question, everyone. I just got to request that again, all right? So first part of Hem's question is, how long does babesia take to treat on average? And I think I have found the second part of your question here, Hem, and that says, and are blood tests reliable to find out if babesia is cured or in remission? Okay, so there's two parts to Hem's question. One is, when you're done treating it, is there anything you can do to figure out if you're really done with it? Is there a test you can do? And the second part to Hem's question is, how long does it take to treat babesia? So on average, to treat babesia is about 4 to 5 months. And generally, I like to treat for 5 months. The reason we treat that long for most strains of babesia is babesia lives in your red blood cells, and red blood cells have a life cycle, the amount of time they live in us after they're made by the bone marrow. They have a life cycle of about 3 months. Most of my colleagues find that we have the least chance of getting into a babesia relapse if we treat babesia longer than one life cycle of a red blood cell, which is 3 months. I tend to find we need to go up to 5 months for how we treat, though. Some of my colleagues treat for 4 months. The idea behind treating for at least one life cycle is that you want to chemically bathe the new red blood cells as they're being born with your anti-malaria agent as they're being born. And you need to do that through at least one whole life cycle so the ones that already have babesia living in them can't reseed the ones that are being born, basically. So the only strain of babesia that sometimes takes more than that 4 to 5 months actually is the strain that used to be called the WA1 strain, WA-1, now called Babesia decani. That strain sometimes takes about 10 months. In fact, when I see somebody that I know has that strain, if they've had testing done that shows that, I will treat for 10 months. But 90% of the time, my babesia treatments, I give people an anti-babesia agent for about 4 to 5 months, and that's it. If you're on the right babesia treatment, usually within about 1 to 2 months, you should start seeing some of those babesia symptoms get better. In terms of testing for babesia, we don't have good testing to either discover if it's there or to see if it's done. The testing that we do have has the ability to look to see if you have antibodies against a couple of strains, actually 3 strains of babesia. However, we estimate that you may actually have, in people with Lyme, there may actually be about 15 to 20 strains. So we can test for maybe 2 or 3, but we only have, but we may have 15 to 20 strains. So you can see testing is not a good way to go for babesia. And I make my decisions to treat for babesia and also to determine if I am done treating babesia based on what the symptoms tell me. All right. So let me show you a couple articles to look at here later. I'm not going to go to them in too much detail, but I am going to do a screen share so that we can look at these together. All right. And so I'm back in our website, www.treatlyme.net now, and I'm going to go into the Treat Lyme book, which you'll find on the left-hand navigation menu here. All right. So take a look at the table of contents. And in the table of contents, there is a chapter called How to Diagnose. And on the article list for that chapter within the book, there is an article called How to Diagnose Babesia. All right. And I even say in this article, don't trust the test. All right. There's a whole video here too. For those of you that are listening in and aren't seeing this, or maybe listening to the podcast, there's a video you can play within the article too. And again, this is an article found in the Treat Lyme book. But in here, I basically say you need to look and see what the symptoms tell you. All right. And I list out what those symptoms are. And you're going to follow these symptoms as you treat. So symptoms that can suggest babesia are drenching night sweats, temperature fluctuations, panic attacks, headaches in the front of your head, feeling off balance while walking, air hunger, which means you just feel like you can't get enough air in at times, racing or skipping of the heart, and regular deja vu experiences. These are kind of symptoms that will follow. The big ones are panic attacks and night sweats. Those tend to be some of the hallmark symptoms. Having regular deja vu experiences is kind of an odd symptom, but it gives a useful way of following what's happening with babesia. It's a very useful way to follow what's happening with babesia treatment. If you're a person that has that as a symptom, that goes away as you treat, all right? So you want to follow your symptoms, those symptoms that I just read. You want to follow those symptoms. And when they're gone, and if you've treated for 4 to 5 months, you're done with the babesia treatment. I don't go back and retest. I don't find the testing to be helpful. Thanks for that question, Hem. Good luck to you. All right, let's see here. So I'm just erasing that on my end. All right, next question is from Iona. Hello, Iona. I don't think I've seen you here for a while, actually, so welcome back. Or at least you haven't posted a question here in a while. Hi, Dr. Ross. I wanted to know if I need to be concerned about getting IV contrast. I have a CT in a couple days for my head and neck. I'm currently taking Methylguard and N-acetylcysteine, that's what NAC is, everyone, but don't tolerate glutathione well. Is there anything else I can do to get the contrast out of my system quickly? Okay, so contrast, everyone. Iona is going to be given an injection of something into her veins that will circulate through her blood system and therefore deposit and actually be able to show the blood vessel system when her CAT scan is done. And she's concerned that it gets cleaned out. And so what's going to clean it out is the kidneys and the liver. It depends on what contrast is used, actually, but they're going to be involved. In terms of what the liver uses, the main agent that the liver uses to detox chemical out of us is glutathione. All right, glutathione is the master detox chemical. There's other ones used by the liver too, but glutathione is the master. Now, ways to raise glutathione so you can detox out. One is to take glutathione, but obviously you're not tolerating it, and that's fine. Another way to raise glutathione, though, is to use N-acetylcysteine, which is the NAC. N-acetylcysteine is a chemical building block. It's one of the bricks that is used to make glutathione. And in fact, I'm using it, I kind of use it interchangeably these days. How my practice has evolved here recently is I use either glutathione orally, and for that I like a product called Trifortify Orange, made by a company called Research Nutritionals. They actually have some good research that came out recently showing some marked elevation in red blood cell levels when you actually take the oral glutathione. So it appears that their product is well absorbed, but that can sometimes be a problem with glutathione. It may not be well absorbed. But another way that I'm trying to raise glutathione levels is N-acetylcysteine. I think it works quite well. It's 500 milligrams, 1 pill 3 times a day. and it's NAC. I like a product made by Thorne called Cysta Plus, which is a really good product for that. Okay, and so yeah, I think that would be helpful. Also, MethylGuard is for those of you that I'm not going to go into it now, but MethylGuard treats a specific detox problem called MTHFR detox problem. You can find an article about that in the Treat Lyme book if I don't get back to it tonight later, but that would be useful as well too. And I think the best that you could do with to detox is be on your NAC, be on your MethylGuard. Make sure also that you're drinking plenty of water. A good amount of water to help promote detox in the body is roughly a formula. There's a formula you can use, which is to take your body weight in pounds and divide it in two, and then have that many ounces of water a day. That seems to be a really good amount of liquids to help promote detox, all right? And that's a lot of water, actually, okay? So a 150-pound person would have 75 ounces of water a day, and that's a good amount to help with that, all right? Beyond that, beyond supporting your detox mechanisms, Iona, to get the toxins out, I don't find that people have adverse outcomes that get harmed when they use IV contrast during their CAT scans. I don't see that people go backwards with their treatment, for instance. So I think you should be okay. I don't think you're going to have a problem with that. All right? All right. Good luck to you. Thank you for that question. All right. Let's see here. Next question is from Ellen. Hello, Ellen. Welcome here. Let's see. Hello, doctor. What is your opinion of electrocleansing? Also, what is the best way to take care of hypothyroidism while battling Lyme? Thank you for all you do. So, Ellen, I get stumped every now and then. I learn new things that people are trying, and I am not clear what electrocleansing is. I haven't heard that term used before, so I can't answer your question. In terms of hypothyroidism, so I'd like to make sure that people are on good nutrients, good multivitamins to help support their thyroid. And the one that I like to use actually is just a good multivitamin. There's two that I use. One is called a product made by Thorne called Metaclear. You do 2 scoops a day, or the other one, a product made by Integrative Therapeutics called the Energy Infusion. I find both of those are really good to use in Lyme, and the nutrients in those will be beneficial to help your thyroid work. In addition, though, if you happen to have low thyroid, I like to replace thyroid. And I like to use desiccated, ground up thyroid gland from pork, also known as armour thyroid. The other way you can prescribe thyroid is to use the synthetic called levothyroxine or Synthroid. But I think the ground up thyroid tends to work better. I think it's a little bit more bioactive. At least that's what I see in my practice. I think people get a better effect from it, okay? Now, about thyroid and Lyme, I tend to manage thyroid based on clinical symptoms. So the symptoms I like to look at that can suggest if somebody has low thyroid are, do you have cold intolerance? Meaning, do you have to wear more layers than everyone around you to stay comfortable? You can even use that as a guide, even if you're in hot areas. So if you're in air conditioning and you're still wearing more layers than everyone around you, that still is cold intolerance, okay? I also like to look at whether people might have hair loss. If you have low thyroid, sometimes you'll have hair loss. Sometimes with low thyroid, you can have dry skin. So those are the kind of symptoms that I might look at that can indicate if somebody has low thyroid. And if they do clinically, I will use armour thyroid, 30 milligrams, 1 pill a day is where I'll start. Now, let me talk about thyroid testing, because many of you may have doctors that are trying to manage your thyroid based only on thyroid testing. And if they do, they're going to get it wrong, all right? So there's 3 thyroid tests, 3 common ones. There's some other ones that can be done too. But the more 3 common ones are measure something called thyroid stimulating hormone, also called TSH. Measure the actual thyroid hormone levels, which is T3 thyroid and T4 thyroid. Thyroid stimulating hormone is a chemical that is made by a part of your brain called the hypothalamus pituitary. And it is used to direct the thyroid gland to make T4 thyroid and T3 thyroid, all right? The problem in Lyme disease is that there, as I've discussed before and even mentioned earlier tonight, Lyme is a syndrome of too many cytokines. Essentially, most of your Lyme disease symptoms are actually symptoms created by having too many of these inflammatory chemicals called cytokines in you. And the problem with that is that those cytokines interfere with the part of your brain that directs the thyroid gland called the hypothalamus pituitary. It's that part of the brain that makes thyroid stimulating hormone. The analogy I like to look at, or the comparison, how I explain what happens, is TSHs in Lyme disease are not reliable. In fact, I don't even really think they should be measured, or we measure them and look at them, but kind of interpret them with a grain of salt. Okay, so again, TSH is made by the hypothalamus pituitary, but metaphorically what happens in Lyme is that part of your brain gets drunk on cytokines, all right? And as we know, drunks, you can't quite trust what they're saying. I mean, they may say something, may be true, may not be true. The brain probably erroneously makes thyroid stimulating hormone. So the levels you measure when that brain is drunk on cytokines, who knows what it means? So instead, and that's what most doctors do. We're taught as MDs and even as NDs, naturopathic doctors, to primarily focus on thyroid stimulating hormone. And if it's normal, we don't even care what happens with the T4 and T3 levels, okay? But in this disorder, you got to ignore the TSH. You got to ignore it. Yeah, we have to interpret what's happening thyroid based on symptoms instead of letting the brain interpret. Okay, so physicians and even you need to take over. You need to say, wow, I think I have symptoms of low thyroid. Then we look at the T3 and the T4 level, and if they are in normal range, that's a range, okay? We can raise those levels up. So look at your symptoms. You can measure T4 and T3, but if they're in normal range and you have symptoms of low thyroid, ignore your TSH and give thyroid, all right? So to answer your question, take thyroid if you need to, but also use the multivitamins as well too. Thank you, Ellen, for that question, and good luck. All right, let's see what's next here. So this is from Jill. Hi, Dr. Ross. Oh, hi, Jill. I don't know if there's a second more to your question there. Let me see if I find something wandering around on my question board here. Nope, not seeing something wandering around on my question board. So I'm not, hello to you. Thank you for saying hi. Get rid of that. I'm getting rid of another question, the second half of Hem's question. All right, let's see here. Okay, so this is a question from Emily. Hello, Emily. Let's see. My symptoms have improved over the course of treatment. Oh, good. I'm glad, actually. But I still have issues of episodic oral pain, loose teeth, and irritation after eating certain foods. Dentists can find nothing wrong. Any recommendations, supplements, holistic dentist? Have you seen these symptoms in patients before? No, actually I haven't. And you know, I've been treating chronic Lyme disease, focused on it as the main focus of my practice since probably 2004, 2005. So in that amount of time that I've had that almost as the exclusive focus of my practice, no, I have not seen that. Well, it's not quite true. I haven't seen it as the main focus of problems that remain. People can get loose teeth in Lyme. I have seen that occur. Sometimes it occurs because Lyme can lead to dry mouth. Some of the medications that we take can lead to dry mouth. You just don't make enough saliva. And that can lead to loosening of the teeth. That is a problem that can happen. The oral episodic pain may be part of a neurologic involvement. The nerves still up in the face may be involved, and the nerves that feed the teeth may be involved. Irritation with certain foods, I'm not quite sure what that means. The one thing, boy, I think, Emily, I think I would need to ask you a lot more questions about this. But just on the face value, what you're asking here, I don't know of any one specific recommendation I would have for you. So I'm sorry, I'm not gonna have good ideas. I have more questions to ask you, but obviously this format doesn't allow for more questions. I'd be glad to entertain ideas with you. One idea might be too many yeast in your mouth. Some of it could be dry mouth, like I just said. If you want a little bit more direct help from me, you might consider looking at the one-to-one medical consult. Set up a half-hour visit. I might be able to come up with some other ideas if I could ask you some more questions as well, too. All right. Good luck to you, Emily. I'm sorry I can't be more specific than that. All right. Let me go ahead and move on here. Hello, Marilyn. Let's see here. I got to double check something here. Wow, we got a huge turnout tonight. This is probably one of the largest turnouts I've seen in a long time. I'm glad so many of you have been able to join me here tonight. I hope we get some answers for you that can help you with your Lyme care too. All right, let me go back here. Hello, Meryl. Let's see. I've had Lyme for 8 years, was recently bitten again, got the Doxy for 6 weeks, but still have day sweats with bad headaches. What should I be taking to start getting better again? Well, that's a big question. I mean, if you got sick and you did doxycycline for 6 weeks and your main symptom is day sweating makes me wonder about Bartonella as a co-infection, okay? Now, there may be more going on, but just that one symptom alone makes me wonder about Bartonella being present. So one suggestion I have for you, Marilyn, is take a look at the article. There's a chapter we have in the Treat Lyme book found at www.treatlyme.net. Look into how to diagnose chapter. There is an article in there called "It Could Be Babesia or Bartonella, the Signs and Symptoms." Look at that. See if you have a number of other symptoms of Bartonella. And if you do, you may need to be treated for Bartonella, okay? But day sweats, that ongoing day sweating, is something often we can see with Bartonella. I can't tell from your question here whether you're still on a Lyme treatment or not, so it's hard for me to say what else to do. In terms of other things you might want to look at besides is Bartonella still active, if you are still having, boy, there's a lot of questions I need to ask you. Marilyn, just based on the sweats, take a look and make sure you don't have Bartonella. If you were in a good place and you're not well, take a look and see if you have Bartonella. And if you did 6 weeks and you were already pretty healthy after, before you got bit again, it may be that Lyme is active and you actually just need to go back in and do a whole Lyme treatment. And in terms of how do you do a whole Lyme treatment, well, take a look at the successful treatment recipe, which is our Lyme disease treatment guidelines. Usually I'll have gone through those tonight a little bit. I probably will show those later, but you can find those on the Lyme guidelines tab on the left-hand side of at www.treatlyme.net. Look under the guidelines tab. I tell you how to build a whole Lyme treatment, all right? But if you want more specific advice, because that's a pretty big question for me to give you specifics, take a look at the one-to-one consult. I'd be glad to look at that with you as well, too. All right. Good luck to you. All right. Let's see here. Hello, Eric. Let's see. My LLMD gave me 60 milligrams of Armour thyroid to support my thyroid. My TSH before Armour was 4 to 4.5, and my current numbers are TSH 0.921, T4 direct 0.95, and reverse T3 12.2. Do you think it's necessary to stay on Armour throughout my Lyme treatment? I also take ashwagandha, 1 year of treatment so far. Okay, so Eric, so in terms of looking at your numbers, again, as I discussed earlier tonight, I just don't even bother relying on TSH. So I'm not sure if that TSH being lower actually suggests improvement or not, okay? Again, it doesn't mean anything to me. Your T4 direct is in normal range. Your reverse T3 looks good, all right? So the numbers look good, but what is more of interest to me is what are your symptoms telling us, all right? And as I mentioned earlier tonight, you have low thyroid if you have cold intolerance or if you're having hair loss or a lot of dry skin. Those are symptoms that might make you think of having low thyroid. In terms of should you treat throughout your treatment, yeah, I probably would remain on your thyroid throughout your treatment unless you start getting hot or you start getting anxious, all right? But generally, I find as you're treating, if the rest of your Lyme symptoms are getting better, that indicates overall you're having less cytokines. And as you have less cytokines, you're going to have less interference with how your hormonal regulation goes. Therefore, over time, you may be able to start decreasing your thyroid. But if you still have a lot of symptoms of Lyme in your treatment, that means you have too many cytokines, which means your thyroid's not working well, in which case I would continue on higher doses of thyroid. Somewhere in there, you may want to test periodically about pulling back on the level. But generally, thyroid is one of those last things I see to improve in Lyme. And generally, I'm going to leave people on thyroid treatment if they need it. At the beginning, they're probably going to need it throughout the treatment to some degree until near the end when things start getting a lot better. Okay? All right. Good luck, Eric. All right. right, let's see here. Next question is from Jane. Hello, hello, Jane. I just need to take a quick sip of water here. Just a minute. All right. So, hi, Jane. So Jane says, today I learned that I'm deficient in immunoglobulin G subclasses 1 and 2 and immunoglobulin M. I have Lyme, babesia, and Bartonella since 2008. My doctor recommends IVIG therapy. Your thoughts? Thank you, Dr. Ross. You're welcome, by the way. So immunoglobulins, everyone, another term for that is antibodies, all right? So if you have low immunoglobulin class G, it means you're making a low amount of IgG antibodies. It looks like you may have low immunoglobulin Ms, which is another family of antibodies called IgMs. We fight infections acutely with IgMs, and then after an infection has been in us for a while, we will develop IgGs. Both are needed to fight infection. So if you have low levels, it's going to make it harder for you to treat infection. Now, I don't often start by giving IVIG, but if we've treated for a period of time and I've got somebody that has low antibodies, if we've treated for a year or even 2 years, and they're having low antibodies, I think it is worth an experiment of trying to see if giving IVIG will make a difference for you. Giving the antibodies will make a difference for you. Having said that, there are some risk involved, okay? And what the big risk is the way that we get IVIG, how you get these antibodies that you can inject, is they're collected from multiple donors. I mean, there's large numbers of people that donate to come up with that small amount of IVIG that you're going to inject. Now, the problem with that is even though they are screened for infections like HIV and hepatitis B and hepatitis C, there may be some germs that still get through from those infections, but even other infections, all right? And so you could be getting other infections that may interfere with your body's ability to get well. However, if you've done pretty good Lyme treatment and you're not getting better and you've got low IgG and IgM levels as you do, you may get benefit out of doing the IVIG, and I would recommend it actually, all right? Thank you, Jane. Good luck to you. Good luck to you as you think about whether to do that or not too. All right, let's see. Next question is from Marilyn. Hello, Marilyn. Let's see. Actually, we answered that earlier. Let me get rid of that. I think you posted it twice, but I got to it at least one time. Hello, Julie. Let's see. Let me post Julie's question here, everyone. So Julie says, what is the best way to test for Candida? I did an organic acids test and my aerobiome is 40 when the limit is 20. I was given diflucan every other day with nystatin 3 times per day. That did not lower my yeast. So I was given ketoconazole every other day, and that just made me feel awful. All right, so there is not a good way to test for yeast, unfortunately. And I don't think there's any accuracy in the kind of test you did. Another way that some of my colleagues will wind up testing to see if you have too many yeast is they'll actually do stool studies to see if you have too many yeast. But we all have yeast living in our intestines, and we all have bacteria living in our intestines. The problem with yeast is if they grow too much, they push the good bacteria out. Then you get into poor digestion. In addition, too many yeast in the intestines trigger too many cytokines. You get the picture, right? I've already talked about Lyme disease, everyone, tonight, being a syndrome of too many cytokines. And if we've got something else triggering cytokines, it's going to make the whole picture look a lot worse. So we need to keep the yeast down too, all right? So one other test that my colleagues will do, and I don't again, is they'll measure antibody levels to see if you're making antibodies against yeast. But again, yeast live in our intestines, so sometimes we might develop antibodies against them. It doesn't tell me whether it's an active infection. So what I like to do to help figure out at the beginning of treatment, if somebody has too many yeast, I use a screening tool. And it's a screening questionnaire. It's a 3-page questionnaire that looks at risk factors for yeast. And it also looks at the symptoms that people have of yeast. And it says, and it measures how intense those symptoms are. If you score over 140 on my yeast questionnaire, there's a good chance that treating yeast will help you. All right. Now, notice I said it doesn't diagnose yeast. It just says, yeah, you've got enough risk factors and intenses enough symptoms because you scored 140 or higher that there's a good chance that treating yeast will make a difference. Okay. So at the beginning of a treatment, I will do the yeast screening questionnaire. I'll show you where you can grab that here in a minute. During treatment, I will consider if somebody has yeast based on what's happening. So during treatment, if somebody suddenly starts doing worse after they're doing better, about 90% of the time, I find yeast can be involved in that. So it's things that make you think about yeast during a treatment. If you've already cleared yeast from the beginning, the things that I look at during treatment is if somebody has increased sugar cravings, if somebody has gotten dramatically worse overall with their Lyme, okay, because yeast trigger more cytokines, which can make it look like your Lyme got active, but really it's just your more cytokines got active. And again, everyone, yeast symptoms are too many cytokine, I'm sorry, Lyme symptoms are too many cytokine symptoms. The majority of yeast symptoms are too many cytokine symptoms as well too, okay? So sugar cravings, a dramatic decline in how you're doing, acne or skin rashes actually, or pimples showing up. For some reason, yeast results in skin manifestations of acne and even rashes showing up. Intestinal gasiness and bloating in a woman, vaginal itching, vaginal discharge, sometimes difficulty swallowing. Things can feel like they get caught here in your throat or down here in your food pipe. That's because sometimes yeast can grow in those areas. Also, look in your mouth, see if you've got white patches. Those are things that make me think of too many yeast too. Okay, so let me show you the questionnaire. In terms of ideas to treat yeast, let me show you an article, Julie, that you can take a look at. There's a number of things you can still try. Let me do a screen share here, everyone. All right, so for those listening in on the podcast tomorrow, I am going to our Lyme disease information site at www.treatlyme.net. When you get there on the left-hand navigation side, click on the table of contents and then click on the chapter called Yeast. So I've got a whole chapter I put together on yeast for everyone. And there's, in terms of yeast, in terms of how do you diagnose yeast, take a look at this article in the Treat Lyme book. Again, you have to subscribe to the Treat Lyme book to get to this article. But it's the article is called A Silent Problem. Do you have yeast? All right. If you are not subscribed, when you click on the article like I just did, there will be a big screen that will pop up saying subscribe. Okay. That's how you subscribe. All right. Now, in this article called A Silent Problem, do you have yeast? Down here is the yeast screening questionnaire. Just click on this and you'll see, as you're seeing on my computer screen here, this is the yeast screening questionnaire. All right. Basically, you're going to fill this out. And if you score over 140 points on this questionnaire, there is a good chance that you have too many yeast, okay? Now that's at the beginning. After you have treated yeast, or if you have never treated yeast, that's the most accurate tool you can use. But if you have ever treated yeast with 30 days of a good yeast-killing medicine, and you're wondering if you have yeast again, that yeast screening tool is not as accurate because it looks at historical, it has some historical questions in it too that never change. The history never changes. Therefore, those questions will still add to your score. So during treatment, then what you want to do is you want to take a look at this other article, or during treatment, I told you just a few minutes ago, take a look at those other questions that I was mentioning, okay? Which has to do, again, with sugar cravings and gasiness and bloating, acne, rashes, difficulties swallowing. Did you crash all of a sudden? Those are things that might make me think about yeast during the middle of a treatment, all right? Now, what are you going to treat your yeast with? Well, back here in the yeast chapter again, there is an article called Kills Yeast, A Brief Guide. And take a look here. I give you numbers of things that you can do to get rid of yeast, especially if the conventional treatments are not working for you, okay? All right, I'm not going to go through that here right now. This is something that's very easy to look at later after the webinar is over. All right, so let me go back here again. So, Julie, thank you for that question and good luck, okay? All right, let me move on here. Okay, next question is from Jill. Hello, Jill. Thank you for all you do. You're welcome, Jill. As I've told people here before, my mission is to help as many people recover from this illness as I possibly can. I can do that here one-on-one with people in my office, but I think I can even help a larger number through these types of webinar service that I offer, and also the Treat Lyme book. I think has got a lot of useful information in it. For those of you that aren't getting enough of your questions answered, believe me, there is a lot of information in the Treat Lyme book. Feel free to take a look at it later. Click on the articles. If you aren't subscribed, you're going to be asked to subscribe. But look at the table of contents and go to the chapters. Look and see the article list and the initial excerpts of each of those parts of that chapter to see if you might find it helpful. Give it a try. If you subscribe do the 1-year subscription that auto-renews every year, you have 1 day to try it for free, and if it doesn't work out, then we cancel the subscription. But there's other options. There's an option where you can subscribe on a monthly basis, and then there's a one-time purchase option. Okay, but I encourage you to take a look at it. I think all the information I'm giving you here right now, most of it, you're going to find something in the Treat Lyme book as well too. Okay, all right. Jill, so let me go back here again. Get a little long-winded there. Let's see. I was infected December 2014, tested IGeneX positive for Lyme and Babesia decani. Saw an ID doctor and was treated with Doxy, Cipro, and azithromycin over the course of 4 months. Was told symptoms would go away in 6 months, but they have not. What should I do now? Okay, so we got a big problem here, Jill. Your doctor didn't treat you for Babesia. Unfortunately, I don't see this as a decent Babesia treatment. That's my big comment, okay? That doxycycline and azithromycin used together is a good Bartonella treatment. Doxycycline and azithromycin used together also treat intracellular Lyme and spirochete Lyme. Everyone, the Lyme germ lives in you in 3 forms. We have to treat all 3 forms. The doxy and azithromycin treats intracellular Lyme, a kind that lives inside of cells. They also treat spirochete Lyme, okay? Cipro does nothing for Lyme. Cipro treats Bartonella, which makes me, and also Doxy plus Cipro treats Bartonella. I would never mix Cipro and azithromycin together. I hope your doctor didn't do those at the same time, because there's a heart risk actually. And that risk is both of these can cause a heart rhythm problem, and you put the 2 together, there's a greater chance of getting that heart rhythm problem, right? On their own individually, the chances of getting a heart rhythm problem are extremely rare, but you put the 2 together and you might have problems. So I wouldn't put those 2 together, and I don't put those 2 together in my practice, all right? Doxy by itself occasionally can treat, well, actually, it may help treat Babesia, but by itself, it's not going to get rid of Babesia. So one thing I would say is I would probably see if you can find a Lyme literate medical doctor, somebody that actually knows how to treat chronic Lyme disease. Maybe you did see somebody that calls themselves that, but I really question what this person did with you. If you have testing for Babesia decani, you should have been treated differently to treat the Babesia. And one of the reasons you may not be getting better is your Babesia hasn't been treated. In addition, in terms of your Lyme germ, they didn't treat for the cyst form of Lyme, which is the 3rd form of the germ. So when you treat for Lyme, you have to actually treat for all 3 forms. You've got to treat for intracellular spirochete Lyme. You also have to treat for the cyst form of Lyme, all right? So your doctor did not cover for that as well, too. So I think you still need to be treated, actually. And I'm sorry to have to say it just like that. In terms of treating Babesia, there is an article that I have on that. Basically, the central part of a Babesia treatment is to use antimalarial agents. And the big ones are a drug called atovaquone, also known as Mepron, another one called Malarone, which is also known as atovaquone with an ingredient added called proquenil, a quinine-like medicine added to it. The herbs are artemisinin, another one called cryptolepis. There's another prescription medicine called coartem. There's another one called lariam. Anyhow, there's options that you have, but your doctor didn't use those. So If you would like help designing a treatment, take a look at the one-to-one consult. I'd be glad to give you some advice on where to go from here, maybe even herbal options. But essentially, I don't consider, from what you've just, at least the information you provided me here, you weren't treated for babesia, unfortunately. And I don't think you were given a comprehensive enough treatment for Lyme as well, too, because I don't think the cyst form of the Lyme was adequately treated. All right. So sorry about that, Jill. And I hope you can find some help too. Good luck to you. Bye-bye. Oh, Jill, actually, everyone, let me do a quick screen share here. All right, so we're back in the Treat Lyme book here. I'm going to go back to the table of contents. So Jill, take a look at the chapter called Infection Treatment Plans. And anyone that's listening to this, okay, there's a few things that you want to look at. One is the article I wrote called Kills Babesia, A Brief Guide. In fact, I most recently updated this in December 14th, okay? And you're going to see that I list out various ways to treat it here, okay? The other article that you want to take a look at about how do you treat Lyme, because again, I question the adequacy of the Lyme treatment you had, again, is in the Infection Treatment Plans chapter. And again, to my podcasters listening in here, the Treat Lyme book is found at www.treatlyme.net. Also at that site is where you sign up for the live webinars, or you can see the recorded version as well, too. And anyhow, there's an article that I have here about treating Lyme, the right antibiotic combinations to use, and that's called Kills Lyme Germs, A Brief Antibiotic Guide. And in here, I talk about the need to use antibiotics to treat all three forms of the germ, which I don't think your doctor necessarily did, okay? And I give you a bunch of other considerations. I actually give some sample ideas of how you build a treatment down here in the middle of the article, all right? But take a look at this later, all right? And this happens to be one of the free articles. You'll find it by clicking on the free tab over here on the left-hand navigation article. You can find this article, the Lyme disease treatment article, at least you can find as a free sample article that I have, okay? All right, so let me go back here again. All right, Jill, good luck to you. And I'm sorry for that situation that you're in. Again, if I can help in any way, I'd be glad to. You might want to consider that one-to-one consult where I can actually develop a treatment plan for you, but you will need to find somebody to prescribe if it requires prescription antibiotics, okay? All right. Hello, Debbie. Let's see. What do you think about the idea of alternating Levaquin with doxycycline along with continuous Septra week by week to treat BART and to try to avoid side effects of tendinitis, GI upset, respectfully? Thanks. All right. So what Debbie is asking is so the Levaquin is an antibiotic that actually is probably one of the strongest antibiotics we have for Bartonella. That and using Bactrim by itself, or Bactrim is Septra, everyone. In Canada, they call Bactrim Septra. And here, so I've given away where Debbie is from. And down here in the States, we call it Bactrim. Sometimes Septra, but most of the time we call it Bactrim. It's a sulfa antibiotic, okay? All right, so Levaquin is a really strong antibiotic for treating Bartonella. And it can, and by itself, probably can get rid of Bartonella within about 2 to 3 months. There's a big adverse problem with it, though, and that is that it can lead to tendinitis. Now, it happens rarely. It's probably less than 5% of the time. But when it does happen, it can become a permanent problem, and that's one of the problems. The other thing is when it happens, it sometimes can lead to breakage or rupture of the tendons as well, too. I used to use it quite a bit in my treatments, but I had 1 or 2 people that actually did have rupture of their tendons. I just don't use it that much anymore because of that, unless I get into nothing else being available to help, okay? So what Debbie's asking here is to avoid getting tendinitis, could you use it in brief spurts, okay? So like 1 week at a time. And then alternate it with doxycycline. And you would be using the doxycycline along with Septra. You'd be using the Levaquin along with Septra, okay? So it'd be 1 week of Levaquin Septra, another week of doxycycline Septra, all right? And what she's asking about the doxycycline here is doxycycline for many people can give nausea and upset stomach. Can give a gastritis, can even give inflammation of the lining of the stomach. So Debbie, in terms of your idea, yeah, I think you could give it a try. I mean, the biggest problem I have, so some people ask me, can you pulse your antibiotics to treat Bartonella? And what they mean is, can I start and stop my antibiotics for Bartonella and not even be on an antibiotic for Bartonella? And the answer is no, because Bartonella replicates every 24 hours, okay? It comes back fast if you're not treating it. But what you're proposing here is to always be on something that treats Bartonella. It's just to rotate what you're on. So yeah, I do think this is an idea. I think by doing this, you could avoid the GI upset and you might be able to avoid the tendinitis, all right? Now, everyone that's listening in terms of the tendinitis and possible rupture of your tendons, one way that you can avoid it, in addition to this idea that Debbie has, which I think is an excellent idea, Debbie, is to also make sure that you're using magnesium. Being on magnesium can sometimes decrease the chances of getting the breakage or the rupture of your tendons, plus developing the tendinitis. And you can use any kind of salt of magnesium. You use magnesium sulfate, magnesium citrate, magnesium malate, magnesium glycinate, whatever the magnesium salt is that you want to use. Dose it somewhere around 400 milligrams at night is what I have people do, sometimes 200 milligrams in the morning. In addition, when you're on the magnesium, it's going to decrease the chances of getting into breakage and also getting into tendinitis problems as well. Okay? All right. Thank you for that question, Debbie. Good luck. Good luck to your daughter specifically, too. All right. Let me go ahead and get out of there. All right, next question is from Phyllis. Hello, Phyllis. Let's see here. Hi, Dr. Ross. Do you recommend treating with antibiotics and herbs at the same time for Lyme for maximum results? Also, can you treat for babesia at the same time as Lyme? So the answer is, and what is your top antibiotic protocol? Boy. Well, you're going for everything here tonight. Let's see here. I want to try to break this into parts here. I have to just briefly read back through it again here myself. See, do you recommend treating with antibiotics and herbs at the same time for Lyme? Okay. So in terms of treating Lyme, to answer your question, so when you say herbs, I'm going to make a distinction. I assume what you're saying is you're making a distinction about antibiotic prescriptions and antibiotic herbs, okay? So in terms of, do I think there's any added benefit by using a Banderol Cemento, for instance, my favorite two herbs to treat Lyme because they work 85 to 90% of the time, which is the same chance of success as prescription antibiotics. Again, I think they work as well as prescription antibiotics do, but the herbal antibiotic products, Banderol Cemento, work 85 to 90% of the time. Do I think you get any increased advantage by being on prescription at the same time? No. I think for most people, no. If anything, you increase toxicity. So generally, I say either use your herbal antibiotics or use your prescription antibiotics, but I don't think you necessarily need to do both, okay? However, there is one time I won't. If I've got somebody on Banderol Cemento and we're not making headway, sometimes I will add an intracellular antibiotic like Biaxin, which is also called clarithromycin, or Zithromax, or a minocycline, or a doxycycline. And the reason I do that is when we look at how the evidence that we have that Banderol Cemento works is based on Petri dish experiments, or modified Petri dish experiments. And in those experiments, we've been able to look under the screen and we can see that, or under the microscope that is, and we can tell that when we expose those germs to Banderol Cemento, that the spirochetes die and that the cyst forms die, and that about 100% of biofilms go away, okay? We can tell that for sure. But when we look under the microscope, we really can't look inside to see if there are, what happens with intracellular Lyme. We assume it goes away. And in fact, what I see clinically in my practice, people get better, okay? But there's potentially one problem with the Banderol Cemento. Maybe they don't treat intracellular Lyme well enough. So sometimes I will go ahead and use a prescription antibiotic with a Banderol Cemento, but it will be specifically an agent that gets inside of cells to treat intracellular Lyme, like, again, Biaxin, Zithromax, Doxycycline, or minocycline, okay? Now, If your question is using prescription antibiotics and supporting herbs, absolutely use the two together. In fact, you're not going to get over Lyme just using prescription antibiotics alone. We need to correct the underlying mess created by having Lyme. And the best way to do that is with herbal medicine protocols. And as you know, the one I like best is my protocol, the successful treatment recipe, where I give you a specific treatment plan that I find has components that help most people get over Lyme. I'll show you that in just a minute. There's many herbs that I suggest that should be used as part of that, okay? All right, then let's see. Also, can you treat babesia at the same time as Lyme? Absolutely. So what I generally will do is I will treat for Lyme and at least one co-infection at the same time if a person has it. I often will not treat for the third co-infection or a third infection at the same time. All right. So if somebody's got Lyme, I'm always going to treat for it. If they got Banderol and just Lyme and Banderol, I'm sorry. Bartonella, not Banderol. If they have Lyme and Bartonella and babesia, I'm usually going to treat for Lyme in whichever of those infections is giving the most problem. So is it Bartonella giving most problem or babesia? I will pick the one I'm going to treat along with Lyme based upon the severity of the other symptoms. So for instance, if a person has, their symptoms are mostly Bart driven, I'm going to treat for Bart and Lyme at the same time and hold off on treating the babesia, okay? Occasionally, I will treat for 3 germs at the same time, but I'm not going to start out doing it right away. I'm going to do it after I'm sure how a person is handling their treatment, how they're handling the toxicities, how they're handling die-off reaction. And if a person is fairly stable treating 2 germs, I may add in treatment to cover the 3rd agent, all right? Now, in terms of whether you choose to treat babesia or Bartonella, if you've got both of those in Lyme, what I will often do is go with the one giving the most problems. However, if everything is equal, I'm going to treat for Bartonella first over babesia. And the reason is based upon some observations of a colleague of mine, Dr. Burrascano. Many of you may know the name Burrascano. Burrascano observed in his practice when he was still seeing patients, before he stopped seeing patients, he thought that if he didn't treat Bartonella first, and you treated babesia first, that it would make it harder to get over Bartonella when you started treating it, okay? Now, I don't fully see that, but he's a man with a lot of wisdom, okay? And so all things being equal, if babesia symptoms are less severe than Bartonella, I'm going to treat for Bartonella, all right? That's how I kind of go about doing it, all right? And then what is your top antibiotic protocol? Boy, there isn't a top one, whatever's going to work. So you can take a look, Phyllis, and I'm not trying to be flippant here. In the article that I have written, well, actually, let me go ahead and do a quick screen share. I'm going to show you a few things to answer that. All right, so I'm back here in the Treat Lyme book, okay? So to answer your question, in terms of Lyme germ treatment, take a look at Kills Lyme Germs, a brief antibiotic guide. In here, I actually give you, down in the middle here, there's a section called Antibiotic Combination Examples. Any one of these 10 antibiotic combinations have a great chance of working, okay? So all 10 of these are my favorite, including the one here, the herbal options, which is about otababark extract, which is a product called Banderol, and cat's claw. For that, I like the product called Cemento, okay? So everyone that's listening in on the podcast, you'll find this at treatlyme.net. Click on the table of contents, and then go to the infection treatment chapter, and then click on the article that is called Kills Lyme Germs, a Brief Guide. All right, now, going back to the table of contents here, then I'm going to go to the infection treatment plan section again. All right, so for my favorite treatments for babesia, click on that, and what you're going to see is I break my treatments into tier 1 treatments and tier 2 treatments. I believe there's even a tier 3, okay? So these tiers are created based on effectiveness, all right? So my favorite babesia treatments are anything in tier 1, all right? And then going back here again to the infection treatment plans chapter, click on the article called Kills Bartonella, a Brief Guide, which again, I updated recently in November of 2015. Take a look at the treatments in tier 1. any of these tier 1 treatments are my favorite tier 1 treatment, or my favorite Bartonella treatments, okay? All right, now just a caveat. One thing you can do with Bartonella, actually, let me go back here. I'll do this so that I can have video feed. So there's one Bartonella treatment that you can actually use as your full Lyme germ treatment, all right? So Bartonella, one of my favorite Bartonella treatments is to use rifampin coupled with either minocycline or doxycycline or Biaxin. One of those three, all right? So rifampin is a really good drug just by itself at treating Bartonella, but I usually like to combine it with another antibiotic to get at Bartonella. All right, and it just so happens that rifampin also treats cyst Lyme and probably treats intracellular Lyme as well too. And if you combine it with a minocycline or a Biaxin or a doxycycline, what you've got is a full Lyme germ treatment then too, all right? Because those drugs also treat intracellular Lyme and spirochete Lyme. So that's a way, if you use a rifampin-based treatment with one of those agents that I just told you about, it's a way of treating two germs and picking up all three forms of your Lyme germ at the same time, okay? So that's just one of those things that I've done over time. All right, now, how do I treat Lyme? Well, many of you, again, are aware of the successful treatment plan. I'm just going to go back here. I'm going to show everyone it here again real quick. All right, so I'm back at treatlyme.net. Again, the majority of this site is the Treat Lyme book. But down here on the bottom left-hand navigation menu, below the Lyme webinar tab, you're going to find Lyme guidelines. Okay, this is the successful treatment recipe, which I wrote a number of years ago now. And I need to get in here. The only thing I need to change here more recently is I have some updated, I need to put a section in here about diet. But look for that probably coming over the next week or two. But anyhow, it basically says these are the key components to getting over Lyme. Well, number one, get sleep. And I give you recommendations on how to do that. Number two, lower the inflammation chemicals called cytokines. My favorite herb to do that is curcumin. Number three, deal with something to help your body deal with stress. They're called adaptogens. I like ashwagandha. Number four, look at hormones. And if you have low hormones, there's things you can do to fix that. Sometimes you don't even need to involve prescriptions in this, okay? And I give you detailed plans of how to do that here. For those of you that are listening in on the podcast, I'm not going through the whole article, but there's a lot of things written here. You'll have to look at this article or this treatment guideline sometime after you're listening to the podcast so you can go into it in more detail, okay? All right, now, essential micronutrients. I like people to be on a good multivitamin. We'll talk about that here. My favorite is a product made by Integrative Therapeutics called the Energy Infusion. Also, you want to treat yeast, and I give you ideas about how to do that here. You want to get your Lyme infection taken care of, and I give you some starting ideas here. Number 8, I give you some basic detoxification steps. Number 9 is deal with Bartonella and babesia. So anyhow, those are kind of the core parts of the treatment. Make sure you're doing those steps, okay? Now, often I'm asked to, what do you do if you're not getting better? Well, take a look at part 12. Right down here, I give you lots of other ideas of things you might want to start correcting, and that's called special considerations for 6 months and beyond. And then I just want to point out one thing in the Lyme disease treatment guideline that I wrote a number of years ago, and this still holds true. Part 13, which is health decline after doing better. All right, so if you're doing better and then you suddenly have a decline, 90% of the time, it indicates you probably have too many yeast that moved into your intestines, okay? So why do too many yeast make it so that you get a huge decline? Well, too many yeast release toxins and they trigger more cytokines. And that can make it look like your Lyme got worse. Again, everyone, what are Lyme disease symptoms? As I said tonight earlier, and I say about every webinar, Lyme disease symptoms are excess cytokine symptoms, okay? So if you've got something else triggering too many cytokines like yeast, it's going to make you feel bad. And in fact, 90% of the time, somebody gets worse. In my practice, it winds up being yeast that's the cause of that. Okay? All right. Thanks for that question, Phyllis, and good luck to you. You guys are asking good questions tonight, and I'm having a good time answering them too. Hello, Jane. Let's see. Today I learned I think we went through your question earlier. Thanks for posting it twice. Let's see here. Let me get rid of that. All right, this is a question from Deborah. Hi, Deborah. Let's see. Hi, Dr. Ross. I have been taking low-dose naltrexone when I go to bed, 1.5 milligrams. I increased to 3 milligrams, but I don't sleep as soundly. I know you advise to take in the morning. What are pros and cons? What is the benefit of this treatment? Also, can it cause arrhythmias and shortness of breath? Okay. So everyone, there's a detailed article I do have on this topic in the Treat Lyme book, okay? So feel free to take a look at that later. But let's talk briefly about what low-dose naltrexone is, and then I'm going to answer your question. So low-dose naltrexone is a treatment that we can use when we think that somebody's Lyme may have an autoimmune component. And what I mean by that is having Lyme in you sometimes can trigger the immune system to start attacking you, all right, causing an ongoing inflammatory condition. So for instance, one form of an autoimmune illness is something you all have heard of called rheumatoid arthritis, all right. Another type of an autoimmune illness is some people have a thyroid illness called Hashimoto's thyroiditis. That's an autoimmune illness. The immune system attacks the thyroid gland, all right? And for some people, when they're not getting better from Lyme, what may happen is it may be an autoimmune illness. Now, I want to make a distinction here because the infectious disease doctors, as you know, don't believe in chronic Lyme disease, right? So one of the things that they believe is they think a lot of this is all autoimmune illness. And I think they may have a point that for some people it is, but they're missing a big part of this, which is the Lyme germ persists beyond anything they think happens, right? They think 1 month of antibiotics always wipes it out, but we know from animal and human studies that that's not so. And they keep wanting to put their heads in the sand on it and ignore that, all right? But I think their point in looking at why do people remain ill, yeah, I think they have an idea that some of it's autoimmune illness, but I think it's only for a small percentage of people. Maybe 10%, I think, is what I see in my practice, not for the 100% of people that they think it is, okay? So they're wrong. But for some people that don't get over chronic Lyme after they've been treated for a year or 2 years of antibiotics, it might be that it has triggered an autoimmune illness, all right? So what is naltrexone? Well, naltrexone is a narcotic blocker. It's a medicine we use that for people that have drug overdoses, and it blocks narcotic receptors in our bodies. Well, narcotic receptors are actually called endorphin receptors. We in our own bodies make a group of chemicals called endorphins, and it just so happens that narcotics bind to endorphin sites. So one function of endorphins in our bodies is that they regulate pain. They're our pain regulation system, but they also regulate the immune system. All right. So what we can do is use naltrexone to provide a blockade of those endorphin sites. And what happens when we do that is the brain doesn't like that. The brain tries to regulate everything. It tries to keep balance in the body. All right. And what the brain will do when it sees that those endorphin sites have been blocked is it sends out a bunch of chemicals using agents called neuropeptides. And it sends them out to cells in the body, and it says, make more endorphins. So the endorphin producing sites in the body start making more endorphins. So now when the naltrexone wears away, when that naltrexone that's been binding to those endorphin sites wears away, what winds up happening is those sites get flooded with all these extra endorphins, okay? So what happens when you flood the sites with endorphins, it re-regulates, it turns down, it turns off and the immune system, triggering an autoimmune illness, all right? So to kind of summarize it up, what naltrexone does is it creates a surge in endorphins, which then re-regulates the immune system. Now, why is it called low-dose naltrexone? Well, naltrexone is manufactured as a 20 milligram pill. That's how the pharmaceutical companies make it. When we use it as low-dose naltrexone, what we need to do is to have it manufactured at a lower dose, at 1.5 milligrams like you're using, okay? And usually the way I'll start is I'll have a person start at 1.5 milligrams one time a day. And then after they've been on it for 2 weeks, then I have them increase it to 2 pills a day for 2 weeks. And then I go up to 4.5 milligrams a day, right? That's how I wind up using it. Now, when you take it at night, sometimes it does give insomnia. And that's what Deborah's talking about here. If you take it in the morning, you tend not to have that. I don't find any problems with taking it in the morning. Most people have no side effects on it. There is a rare person in terms of side effects that will get some mental confusion by being on it, or they might find it a little cloudy. That's a person that is going to do better taking it at night. But usually most people have no side effects. And I haven't seen it at low dose levels give arrhythmia and shortness of breath. I just have not seen that happen. Okay. So I hope that answers your question. Let me go ahead and do a screen share here so I can show everyone where you can find this article later to look at. All right, so I'm back in the Treat Lyme book again here. I'm going to go to the table of contents. The chapter that you are going to find the low-dose naltrexone article in is immune system. And the article is called, what do I call this? I call it On Low-Dose Naltrexone and Lyme, Does It Help? That's one article. I've also presented in a slightly different way in a second article here called When Your Immune System Causes Lyme. I probably should change it to When Your Immune System Causes Lyme Symptoms, all right? Because again, the idea is that Lyme may trigger autoimmune illness, all right? So those are two articles that you can find in the Treat Lyme book in the immune system chapter, okay? All right, let me go back here again. All right, Deborah, thank you for that question. All right, let's see here. Question from Penny. Hello, Penny. Let's see. What happens if you never treat the co-infections? What we think happens, what I observe, and I know my colleagues observe too, is that if you don't treat co-infections, it's going to make it hard to get over Lyme or to put it into remission or even eradicate it, okay? So you need to deal with co-infections. There seems to be some way that having co-infections helps protect the Lyme from treatment. So that's the reason most of us will go about treating. All right, thank you for that question, Penny. Let's see. Hello, Nathan. Let's see. Hi, Dr. Ross. Thank you so much for putting these on. You're welcome. What are you your non-pharma strategies for dealing with challenging sleep? For example, I often fall asleep okay, but then wake up around 2 to 3 a.m. It's really hard falling back to sleep. All right. So there is a whole article. There's two articles that I'll have you take a look at on that, Nathan. Let me go ahead. I'm going to do a quick screen share. So everyone in the Treat Lyme book, and that's where I am again at www.treatlyme.net. Take a look at the table of contents. There's a whole chapter here on sleep. All right. And there is a chapter called Sleep 101, the Basics, and I believe yeah, okay. Well, wait a minute. I'm trying to make sure I understand this. Okay. This is not, oh, there it is. Okay. So I'm sorry. I was confused by something. Okay. So there's two articles that you're going to want to take a look at here. And I'm going to give you a brief summary. Okay. I didn't think that one was popping up. Take a look at this one called Sleep 101, the Basics, and then Sleep Natural Medicines. Okay. All right. About what I'm going to just give you a brief description of this here. All right. So in terms of, some of the sleep basics that anyone ought to consider. Number one, make sure that the room that you sleep in is the room you're not working in and living on your computer in, okay? So try to separate your workspace from your sleep space, all right? Number one. Number two, try to turn off stimulating things at least an hour, 30 minutes to an hour before you go to bed. That means even TV, okay? Number three, try to find the same sleep time every night. And then probably the best sleep is initiated somewhere around 10 o'clock at night. That's going to get you into the most deep restorative sleep. Try to be consistent each night with your sleep time, okay? Some other things you can do from a sleep hygiene standpoint that can help, sometimes exercising. sometime after dinner or early in the evening. The act of cooling down from that will put you to sleep. Sometimes taking a hot bath will help cool you down, put you to sleep, okay? So those are just some sleep hygiene things that I recommend that people do, and that would help get you asleep. Now, I know you're not necessarily having a not get to sleep problem, all right? Then I break sleep down into two. The other thing in terms of sleep, if you got pain, deal with pain. If you have depression, deal with depression. So you want to make sure that you're taking care of conditions that as part of them are things that might trigger sleep problems. Okay, so pain and depression, deal with those through other means. And I have articles about how you deal with pain, and I have articles about how you deal with depression too, but deal with those, okay? All right, so then I like to look at sleep in terms of medicines that are good at getting a person out and medicines that are good at keeping a person out, all right? Most of the herbal medicine options are going to fall more in the camp of being good at getting a person out. And depending on the dose you use, they may also be good at keeping a person out, all right? So what I would recommend that you try, there's two things I would look at. Number one, in terms of things that can be good at getting you out and keeping you out, I would look either at the herb L-theanine, that's L-theanine, or I would look at the herbal medicine product called 5-hydroxytryptophan, which is an amino acid-like compound, right? So tryptophan, you may be aware of from turkey, all right? So the reason people get sleepy when they have Thanksgiving meals here in the States and they have all that turkey, or at other times of years when we have a lot of turkey is rich in tryptophan, and tryptophan can induce sleep. There is a variety of tryptophan I like called 5-hydroxytryptophan. Dosing that works well for sleep is to take 200 to 400 milligrams. Now your tryptophan, 5-hydroxytryptophan, is usually going to come in a 50 milligram or 100 milligram pill. I think we have it available as a 100 milligram pill at our supplement store, okay? And so what you want to do with your tryptophan is to start at 200 milligrams, increase by a 50 or 100 milligrams a night, and work up to 400 milligrams if you need it, all right? And then you can keep using that if you want, and then layer L-theanine in on top of it, or start with L-theanine first, and if it doesn't work, layer 5-hydroxytryptophan in on top of it. In other words, you can use both, okay? L-theanine is a component of green tea, and it is turned in the brain into a chemical called GABA. That's one of the things it does. Brain is full of GABA receptors, and if you give a lot more GABA to a GABA receptor, it helps calm agitation or an agitated state down. The other thing that L-theanine does is it has an effect on the nerves to decrease the electrical excitation or the electrical intensity of the nerve transmission that goes down a nerve tube. So the dose I like to use for sleep is all the way up to 600 milligrams if you need to. And I usually start people at 200 milligrams. Now it comes at a 100 milligram pill, all right? So those are some ideas. You might try putting both of those together, but make sure you're doing good sleep hygiene as well too, okay? All right. So that's my ideas on that. Let me go ahead. I'm sorry. Oh, there we are. Okay, good. So thanks for that question, Nathan. Okay, next question is from Christy. Hi, Christy. I see. Hi, Dr. Ross. What do you think the best antibiotic may be to target Bartonella? I'm currently on Zithromax with no improvements. I have also tried Doxy and Rocephin. Okay, so Christy, we're kind of running later here in the webinar tonight. Take a look at the article I've written called Kills Bartonella, a Brief Guide. Take a look at any of the treatments that fall in the tier 1 category. But generally, I think two favorite to build treatments around is rifampin is one. The other one would be to build a treatment around Bactrim would be another. Those are my two favorites. And that would be rifampin and use, in addition, I would add to it either a doxycycline or a minocycline or a Bactrim I would add to that. Or you can use Bactrim-based treatments, and what you want to add to Bactrim is either a doxycycline or a rifampin or a Biaxin. Those are things that you can add to a Bactrim-based treatment, okay? So those are some ideas for you. All right. Thank you, Christy. Good luck to you, too. All right, let's see. All right, I just want to do one thing here, which I usually will have done by now, but I didn't do it. I'm going to do a quick screen share. All right, and this is because I usually get asked this question, and so I'm going to just show you here. So everyone, I'm always asked, where should I get the supplements you recommend in the Treat Lyme book? All right, and just so you know, we carry different brands of supplements that have the ingredients we recommend in the Treat Lyme book, and we carry them here at our supplement store, which is at www.treatlyme.com. It's Marty Ross MD and Tara Brooke ND supplements. Take a look here. We basically have tried to find products that we consider to be the highest quality. And they're high quality based on two things. Number one, they have ingredients in them that we know have been sourced for the greatest possibility of working, okay? And the second thing that they have is they tend to use artificial fillers that are not going to be toxic to you. And in Lyme, we really got to be careful about not giving you things that you might be toxic to, okay? So so this is the store that our patients get the supplements we recommend, and this is available for you too. Again, you'll find it at www.treatlyme.com. By comparison, the Treat Lyme book and our Lyme disease information site is at www.treatlyme.net, okay? All right, let me go back here again. All right, so let me see where we are here. I'll take another question here. All right, so Jennifer, hello. Hi, Dr. Ross. My B12 is elevated at 1,232, and I'm worried I may have cancer or liver disease. I was told that excess B12 is excreted by the kidneys. I also have the MTHFR genetic defect. Could this be the cause of the elevated B12? So, you know, in and of itself, I don't find problems with elevated B12. In other words, I don't think it's something to worry about. The thing I would look at, Jennifer, is look at what you're taking in. There's probably something you're taking in terms of a supplement that may have B12 added to it. And that might be for MTHFR treatment. It might be that you got it in your multivitamin. You're getting it from somewhere probably, but that level, I wouldn't call that a level to worry about, okay? All right. Thank you for the question too. Good luck. All right, everyone. That's it for me tonight. It's about 6:30 here already. Tomorrow morning, again, look in your email. You'll get an email from me, hopefully, if I get it put together in time, that will have the link to the webinar page, the recording page. Again, tomorrow, look, I'm going to try to have the podcast ready to go too. I have not yet told iTunes that I have a podcast station, so you're not going to be able to get the podcast yet through iTunes. It'll probably be this weekend that I let them know because I'm trying to put up a number of the old podcasts all at the same time. So I don't want to create a podcast station there until then. But eventually through the site, you will be able to go and get our stuff through, or actually be able to get our podcast through iTunes as well too, or my podcast through iTunes as well too. All right, everyone. It's been good having you here tonight. Please, if you're going to join us next week, or even if you're not going to join us next week, please tell people about the webinars here and even the Treat Lyme book. When you do that, you're supporting the work that we're doing so that we can keep doing more of it. Also, what you're doing is you're giving people good information that they can use to recover from Lyme. And I think we have a responsibility, or maybe not a responsibility, but I think it's good when we help our neighbor. That's partly what I'm trying to do here with running these webinars, okay? And I also hope that you'll help me spread the word about what we're doing here by having people spreading the emails I send out about these webinars, let people know about them. But also letting them know about the Treat Lyme book as well too. By being on the webinars, you're now seeing the benefits of the Treat Lyme book as well too. All right. So here in a second, I'm going to take you all over to the Treat Lyme book. And through that site, when you get there, you can either subscribe by clicking on an article, and you'll be given the option to subscribe to the Treat Lyme book. I hope you'll join me in supporting the work that we're doing. The other thing you can do is sign up for next week's webinar as well too. All right. And I look forward to seeing you then. I hope you join us again. Good night, everyone. It's good having you here tonight. Bye-bye.